Have you ever wondered why some babies are born too soon? Welcome to our exploration of a subject that touches many lives: premature delivery. Premature birth refers to the birth of a baby before the completion of 37 weeks of gestation. While a typical pregnancy lasts around 40 weeks, each year, about 15 million babies are born prematurely across the globe. Premature delivery stands as a leading cause of death for children under the age of 5. It's an issue that can lead to serious health challenges, as the organs of these early arrivals, especially their lungs and brains, may not be fully developed. The degree of prematurity can vary, with those born very prematurely, such as before 32 weeks, facing greater health risks. In the next few minutes, we will delve into the causes and effects of premature delivery, and ways to potentially avoid it. In our exploration of the causes and risks for premature delivery, there are several key points to note. To begin with, we ask the question, what triggers premature delivery? This question, often asked by parents-to-be, has a variety of possible answers. A central cause of premature delivery can be associated directly with pregnancy conditions. For example, conditions such as preeclampsia, HELLP syndrome, and gestational hypertension, all of which are blood pressure related, can often instigate early labor. Moreover, gestational diabetes presents another risk. Elevated blood sugar levels can affect the mother's health and potentially result in early birth. But medical conditions aren't the only triggers. Lifestyle choices and individual characteristics are significant risk factors as well. For instance, the mother's age can influence the timing of delivery. Particularly, women under the age of 17 and those over the age of 35 are at a higher risk of delivering prematurely. Additionally, substance use, such as drugs or alcohol, interfere with the baby's development and precipitate early labor. It's also worth noting high levels of stress and poor diet can contribute to premature delivery too. In some instances, unforeseen events can stimulate the onset of premature labor. Examples include placental abruption, where the placenta separates from the uterus birth, and an incompetent cervix, which opens prematurely. Hormonal changes can also spur early labor, causing stress in the unborn baby or mother. Furthermore, infections, whether bacterial or viral, can instigate early labor. While we've painted a comprehensive picture, it's important to remember that every pregnancy is unique. Despite all precautions, a baby might still be born prematurely. In such cases, it's not to place blame, but to focus on providing the best possible care for the baby. Understanding these causes and risk factors for premature delivery is an essential step in reducing the likelihood of early birth. Knowledge is power, and in this case, it's the power to potentially avoid a premature birth and ensure a healthier start to life for the baby. Therefore, we urge you to discuss these factors with your healthcare provider and together strive towards a safer, healthier pregnancy. But what happens when a baby is born prematurely? A premature birth may bring a whirlwind of emotions, primarily because the baby hasn't had the full time inside the womb to develop. The most significant concern lies in the incomplete development of their vital organs, particularly the lungs and the brain. Let's paint a clearer picture. The lungs of a premature baby are not fully formed. They lack a crucial substance called surfactant, which prevents the small air sacs in the lungs from collapsing. This can lead to a condition known as respiratory distress syndrome, or RDS, where the baby struggles to breathe. Now onto the brain. In the final weeks of pregnancy, the baby's brain undergoes critical growth and development. If a baby is born prematurely, this process is interrupted, potentially leading to long-term intellectual and developmental disabilities. Premature babies may also face difficulties in maintaining their body temperature due to a lack of stored body fat. They may be more susceptible to infections as their immune system is not fully matured. Additionally, they might struggle with digestive problems because their system isn't ready to process breast milk or formula fully. Remember, the level of health risk a premature baby faces is directly linked to their degree of prematurity. Babies born very prematurely before 32 weeks face a higher health risk than those born closer to the full term. It's a sliding scale. The earlier a baby is born, the higher the risk and the more intensive care they'll likely need. These potential health issues are not intended to alarm or distress you, but rather to emphasize the importance of full-term pregnancy. It underscores why preventing premature birth is an essential topic of discussion for healthcare professionals and expecting parents alike. So while a premature baby may face a mountain to climb, it's important to remember that medical advancements have made it possible for these little fighters to grow and thrive. These potential health issues underscore why preventing premature birth is so important. So, what can expecting parents do to reduce the risk of premature delivery? This question may linger in many minds, and while there is no foolproof method, there are some steps that can be taken to manage the risk. Firstly, maintaining a healthy lifestyle is paramount. This includes a balanced diet rich in essential nutrients, adequate rest, and staying well hydrated. It's important to remember that pregnancy is not a disease, but a natural process that your body is designed to handle. However, it does require extra care, and a healthy lifestyle is the foundation of that care. Consistent prenatal care is another crucial step. Regular checkups allow healthcare providers to monitor your health and the health of your baby. These visits can help detect and manage potential complications early. For example, conditions like gestational diabetes or hypertension, which can increase the risk of premature birth, can be controlled with proper monitoring and intervention. It's also an opportunity for you to discuss any concerns or questions you may have. So, don't skip those appointments. Avoiding harmful substances is equally important. This includes tobacco, alcohol, and illicit substances, all of which can increase the risk of premature birth. If you smoke or drink, pregnancy is a good reason to quit. If you need help, don't hesitate to seek it. Your healthcare provider can guide you to resources and support. Lastly, managing stress is crucial. Pregnancy can be a joyful time, but it can also bring its share of anxieties. It's important to find healthy ways to manage stress, whether it's through relaxation techniques, hobbies, or talking to a professional. High stress levels can trigger early labor, so maintaining a calm and positive mindset can be beneficial. While there's no guaranteed way to prevent premature birth, these practices can certainly help in managing the risk. It's about doing the best you can to provide a safe and nurturing environment for your little one to grow and thrive. Now, let's quickly recap what we've learned today. Premature delivery, or preterm birth, is a birth that occurs before the completion of 37 weeks of gestation. It can be caused by several factors, including preeclampsia, HELP syndrome, gestational hypertension, and gestational diabetes. Such preterm births can lead to health challenges for the baby, particularly with undeveloped organs like the lungs and brain. However, by understanding these risks and taking appropriate steps, we can potentially reduce the chances of premature delivery. Remember, knowledge is power. Understanding premature delivery can help you take strides in ensuring a healthier pregnancy journey.